Good morning, I am Dr. Sireesha Reddy, Consultant Obstetrician Gynaecologist from Motherhood Hospitals, Hebbal. Talking about contraception, obviously not all couple are ready to start the family as soon as they are married as a couple. You tend to notice that they have their set goals, they want their careers to progress, or they want to adjust with each other because they're newly married, they want to adjust to the new environment. So most of them, especially the current generations, wouldn't want to start a family immediately. So what I would say is, like, again, same thing, it is very important before you're getting into a wedlock, it is important to discuss with your doctors what are all the options that are available for you when you would want to, avoid a pregnancy as much of a number of years that you would want to. So there are a lot of options that are available. The doctors would discuss with you what methods that you can follow. There's something called natural methods of trying for avoiding a pregnancy, for contraception, natural methods of contraception. This holds good for people who are having extremely regular cycles. They can time their cycles well. So their fertility, the green times or the fertility time period is very well known, and the red times are also known, where the danger zone, or what we call, that is during the peak fertility. So these days are avoided, and the rest of the days they're okay to have unprotected intercourse. So this is something that you get to know when you meet a doctor. So when you're talking about, there's a huge choice that is available to you from the male point of view and the female point of view as well. From the male point of view, when you're talking about, yes, condoms as a protective thing, using condoms is actually a healthy thing. And as we were discussing about natural methods like timing, avoiding the fertile time period, and this is something that you can practice. And second thing, from the female point of view, you can look out for what is called contraceptive pills, hormone pills that are given, that need to be taken probably 3 weeks in a month, and have a break for a week or so. So this is something that you need to get yourself evaluated before you start taking randomly, because the doctors would assess whether you are a fit candidate, whether you have any medical conditions, comorbidities, that you are not an ideal candidate to start the contraceptive. As well as they would teach you how to, pill teach is very important, to know how you have to take, what to do when you miss a pill, and what to do when you miss more than 2 or 3 pills in a row. All these things will be briefed by your doctor if you go for contraceptive advice. The other option that is available apart from the contraceptive pills are there's something called an injection that can be availed, which is given every 3 months once. This is a progesterone only injection that actually stops you to ovulate, and you tend to notice that your fertility needs are taken care of. The downside with this injection is when you take an injection, as you're taking the injections, you tend to notice your ovarian, the function of the ovaries are completely quietened. And when you want to resume fertility, like you want to become pregnant soon after taking your last injection, sometimes you get there's a little bit of a break that you have to be patient with. It can go up to 6 months to 9 months before you resume your normal regular menstrual cycles. So people, usually these injections we offer for women who have completed their family but who would want to try out this option of delaying their pregnancies, or using what is called a long acting contraceptive methods, which we call them as LARCs. So for them, they are not in need of having a baby immediately after stopping the injection, so they would want to go by it. So that's more an ideal thing for people who are not planning for any future children. The other method that is available is called a copper T or loop, that we common terminology. This is a copper device that is inserted into the uterine cavity on the 4th or 5th day of the period. It is a very simple procedure, gentle procedure, where your doctor does it in her office, inserts the small device into the cavity, which stays there for a number of years that you would want to. Usually the copper T has a validity period of 3 years. Depending on the type you use, or 5 years one. There is a 10-year one available as well for people who would want to use a longer time period. With the copper T, when you're talking about, pretty much it is non-hormonal, does not change your any bodily functions with that. Can alter your periods. It can make your periods slightly go heavier. That is what we ask whenever women are seeking for copper T. We do check with them if they have extremely heavy flow. Probably they may not be ideal candidates, because you tend to notice their flow can become bit more higher. Do not cause any weight gain. This is a common question that is asked by many. that they think that putting a loop on they cause a lot, and most of them are worried about copper T getting dislodged, getting into some organs and all that stuff. But most of the times, commonly obviously it is done under guidance, the doctors know where they're putting it. Extremely rare for it to perforate the uterus or go through the into your abdominal cavity. The common problem that we face is expulsion of a copper T because your uterus considers it as a foreign body and it tries to push away. So that is the reason once we've inserted it, we ask you to come for a copper T checkup on the first month after your first period, as well as probably 6 months down the line, just to ensure that it is not dislocated and it is staying in the cavity. If it gets dislocated, unfortunately, it can end up in pregnancy because it's very low down in the cavity, and the uterine cavity is all open for a pregnancy, and we do come across women with a copper T having pregnancies as well. And the other options that you can go for is, like, if you're sure that you've completed your family, you can go with what is called laparoscopic sterilization, which is like a clipping of the tubes. We put small rings on the tubes through a laparoscope, and then the tubes over time get disconnected with each other. This has to be considered as a permanent procedure, and reversal I would not encourage you all to be looking at. When we consent you, we say that you need to be considering this as a permanent non-reversal method of contraception. So if you're going for it, be sure that you've completed your family. Otherwise, try to use long-acting methods that we were discussing about before, like copper T or an injectable. There's a new device that is coming into the market, which young women who would want to look at other methods of contraceptive needs temporarily can be looked into, which is a 3-year one, which is called an implanon. It's a small plastic rod that goes under the arm. It is kept under the skin, so it is not inserted into the uterus. It is just like a small injection that is given over there. It's a small plastic rod that stays under your skin and provides you the contraceptive needs. That again is also containing only a progesterone, which is pretty much very comfortable with most of the women, and that gives you a protection for 3 years. When your copper T, whenever you think that your contraceptive needs are done and you would want to start the family, you get the rod removed, the plastic pin removed, and your fertility resumes back to normality. So that doesn't affect your fertility on the long run. In the sense, you resume your fertility immediately. There's one more option that is available for people who have heavy periods and you would still want to have something like a copper T or a loop. Is called Mirena. It's an hormone device which is looking like a copper T, but it has got progesterone hormone inside that instead of copper. So what this does is, for people who have heavy periods, people who completely flood out during their cycles and they're a little bit wary about using a copper device, you tend to notice using this Mirena causes your periods to go at least 50 to 60% of your flow reduces, and 30-40% of them become period free actually for longer. And this device works for you for 5 years, and because it is a progesterone and it is locally acting, it is pretty much body friendly to majority of them, and they find it very comfortable to use as well. There are wide lot of options available. Yes, there's something also called emergency contraception, emergency pill. This is something like you have been regularly using some contraception. Let us say you're using condoms, you're using natural methods, somehow you think that your contraceptive has failed, whatever you're using, in the need of hour. Yes, as early as it is being used, immediately that you notice that your contraceptive device has failed for you, use this within the first 24 hours. Yes, pills can avoid a pregnancy that is unwanted, but this is something that you have to take one off. It is not something repetitively. We do come across some young couple who do not know that it should not be multiple times used, and they keep using it in a cycle n number of times, and you tend to notice their cycles become, the female cycles become extremely irregular because they're using hormones that are all like a 4-day hormones are used at one day, at one go, and the cycles start becoming very erratic. So I would say yes, one off it is okay, occasionally it is fine, but not on a regular basis. Do not use pill as your contraceptive device or contraceptive need for you. So it is better that you use the other options. So pill should not be a contraceptive option as a routine. It should be something that is like a standby option that is used. The rest of this, condoms, pills, using copper T, or going for this implanon or the Mirena, or if you think, or the injectables as we were talking about, or if you think your family is complete, from the female point of view, you can go for a lap sterilization, that is tubectomy it is called, Or the male also can consider what is called a vasectomy, which is a very simple procedure, no anesthesia required. It's no scalpel vasectomy is what they call. Extremely successful, much more better in preventing a pregnancy than any female procedures. So yes, that is also an option that is available. Our motto at Motherhood Hospitals, the whole combined team approach is to ensure that you have a safe delivery. We would all want you to go home healthy, safe, as well as your baby to be healthy and safe. This is what we all aim for, and achieve the same and give you the same outcome. Thank you.